So
Great.
this is Melissa Lee from UNH Cooperative Extension. Thank you.
Sure. So we're just gonna spend a few minutes with you this morning talking about this New Hampshire opioid prevention project. Kendra and I this spring decided to create a proposal with support from our team at Cooperative Extension for a SAMHSA funding opportunity that was made just available to cooperative extension entities across the country. Which is kind of a really unique and great opportunity that the federal government is seeing cooperative extension resources as a way to really help reach populations, across the country. So our UNH is considered what they call a land grant institution. And so every state that has a land grant institution has a cooperative extension entity. So many of you may be connected to cooperative extension in your work in the counties that you serve or in the roles that you play in the community in various ways. Just a little bit about extension, there's a lot of different program areas, and really the goal of extension is to bring university level resources out to communities and really make university resources accessible and bring educational opportunities and technical assistance out to populations around the state, so that not everything's centered in kind of that university hub. So that's why we are literally the arm of the university extending out to our counties. So there is a cooperative extension office in every county in New Hampshire, although the staff and program areas at the county level may look a little bit different. But again, many of you may be familiar with we have a community and economic development team and a nutrition connections and healthy living team. 4-H is a staple of cooperative extension work, as well as many other agricultural resource type programs. But as I said, our team focuses on what's called youth and family resiliency, and we certainly see prevention as a piece of that. So just a little bit of background. The goal that we were asked to address through the funding RFP was to look for ways to build upon the existing prevention infrastructure within the state, and really to create collaboration with the state opioid response team. So that work that's kind of housed at BDAS with the state opioid response dollars coming into New Hampshire, how can we partner with that entity and the organizations that are connected and the partners that are connected at the community level to really increase educational opportunities, as well as resources that get delivered out into our rural communities. So again, this was a rural opioid technical assistance grant. Kendra and I made a good argument to SAMHSA that pretty much all of New Hampshire is rural, although we do have some more certainly hubs in New Hampshire of large populations, but even those counties where Manchester and Nashua sit still have rural communities in their counties. So what we're going to discuss with you today and share with you is kind of our three-pronged approach that we created to help address the goals of really looking at opioid misuse prevention. And this grant came to us, we just realized, I don't know, maybe the 1st of August that we were receiving the funds, and it started September 1st. So it is a 2-year grant. And what's really neat about this opportunity, some of the previous grantees, other states that received this, were eligible to get an additional 2 rounds or 2 years of funding based on certainly, showing a positive measures and impact. So we do hope in 2 years that opportunity might still be there for our work, but we certainly are looking at sustainable strategies. So one of the kind of core pieces of our three-pronged approach is that we are going to be increasing capacity around the state to implement what are called chronic pain self-management programs. So this is a strategy that's geared towards adults, community members, patients who may be experiencing chronic pain as kind of a low risk strategy to help folks learn alternative ways that they can manage chronic pain. Now, we're not denouncing or in any way are these workshops saying, that opioid use or other pain medication use isn't appropriate. Yet the activities and the modules in the workshops talk about things like how to use prescriptions that are prescribed to you in a safe way. Some of the messages we often share in the prevention world around safe storage, not sharing your medications, proper disposal when your medication use is through, as well as just empowering people to come together to learn alternative strategies. So this is what's called an evidence-based workshop that's housed in New Hampshire through a licensing organization at the Southern New Hampshire Area Health Education Center. So we'll be partnering with them to beef up training opportunities to increase the amount of facilitators in New Hampshire that can actively facilitate these workshops. So they'd be both in-person and online workshop opportunities made available to community members across the state. And again, kind of looking at the state opioid response infrastructure in those doorway communities, that this could be a resource for, connected to those healthcare systems and healthcare entities, as well as through partner organizations and communities. So if you're not familiar with these self-management resources or self-management education programs, they're designed to be lay-led by lay leaders. So peer-to-peer or non-healthcare leaders, although folks with a healthcare background are certainly welcome to lead them. But they really come from a place of really bringing people together to drive discussion rather than, and it's not an advice giving opportunity or a professional recommendation. It's really an opportunity for people to engage in content related to empowerment and learning about skills that they can share with their peers. So happy to talk a little bit more, answer questions about that afterwards. The second piece, Kendra, would you like to chat about the ECHO?
Sure. So the second piece is that we're going to implement a project ECHO, and ECHO stands for Extension for Community Healthcare Outcomes. This came out of New Mexico, and it's for the way it's going to be set up is going to be for healthcare providers, and they form a sort of learning community together to learn about whatever particular topic. And so here we're going to do one on alternative pain management. So we'll have some experts come in and they'll go through some case studies, but it's to bring healthcare providers together to learn about what are alternative strategies that they can then pass on to their patients. And so then this way it'll increase, again, both the skills for the healthcare providers, so they have some other alternatives that they can present to their patients, but also then that information will trickle down hopefully to patients as well, to give them some other low risk strategies, either to use with, use with their opioids if they need some of those, or potentially just alternatives in general.
Great. And that aspect of our project is going to be coordinated in partnership with the UNH Institute for Health Policy and Practice. Mm-hmm. We're going to, in the first year of our grant, thoughtfully craft out that experience with their expertise and their ability to kind of draw from needs that healthcare providers have expressed to them through some other educational opportunities that they're convening. And then we will actually implement those, it's like a multi-session mm-hmm. Experience in the second year. Mm-hmm. Thanks, Kendra.
Yeah.
So the last piece, I'm sure many of you, if you've worked in the substance misuse field, have heard about the Partnership for Drug-Free New Hampshire. This was an entity that for many years was really looked to as a fantastic resource for educational information as well as campaigns that could be utilized by the public health system or coalitions around New Hampshire. And we are going to be dedicating some of our funds to really help revitalize that resource in New Hampshire. Currently, the New Hampshire Center for Excellence at CHI down in Bow has a contract and some funds from the state to do some of that revitalization. And we thought rather than create a new resource hub for information around opioid prevention, that we would partner and really beef up and make a stronger resource hub that already I feel like is pretty well known across the state. So we're going to be in collaboration with them to develop resources that will really be geared towards a multitude of audiences, as you can see. But we picture, again, some short videos, campaign materials, toolkits potentially that will be housed there on the website. And also we will be helping to sponsor and convene kind of a kickoff conference for the revitalization of this effort. So it probably will take place next summer, next fall. Hopefully not virtual, but it might be, but an opportunity really to engage stakeholders around New Hampshire again in just bringing back this partnership to life and seeing where we can take it for the future, but really just re-emphasizing that it's going to be a great resource hub. So we'll be co-branding some materials and crafting those soon. We're actually going to start that work fairly soon.
Mm-hmm.
So just some notes about some of our partners. Again, the different entities at UNH. We're working with BDAS as well as the Bureau of Elderly and Adult Services. Certainly these chronic pain self-management workshops are seen as a strategy to not only potentially reduce opioid use and misuse, but also reducing falls, reducing isolation for adults, reducing depression. They are evidence-based and have been shown to really make an impact on the quality of life, honestly, for adults and especially older adults. So really excited for that partnership there. JSI Research and Training is that Community Health Institute and the New Hampshire Center for Excellence, and the Southern New Hampshire Area Health Education Center as the license holder for the chronic pain self-management workshops. And I'll just share, because this is certainly one of the pieces of the project that we hope at the community and county, community level, public health system level, that we're excited to mobilize. These workshops that we spoke about, really looking to increase the amount of facilitators that we have in the state. So not only within the extension system, we're going to be building the capacity of our educators that provide other types of program efforts in communities, but looking to find community level partners that might also be interested in facilitating these workshops. And again, they're designed to be in community settings. So whether that's, at a community center, at a faith-based organization, or, at a library in the community, they're really designed to be brought out and made accessible to those at, in your greater communities. But they do require a co-facilitation. That's part of the fidelity from the National Self-Management Resource Center. So pairs of leaders. So whether your organization or if you know somebody else in the community that might be a good facilitator. Also, our extension staff are looking for kind of co-facilitators out in their various communities. It's great if someone has the experience of managing chronic pain or a chronic illness, just for that kind of empathy perspective. But that also could be, supporting someone in your life, a parent, an aunt or uncle, a neighbor who's experienced some of the symptoms and effects of chronic pain. They're highly participatory classes. Again, one of the reasons why I think they're so impactful is that people do come together and share and learn from each other and really kind of build each other's confidence in their ability to manage chronic pain. And, you know, most folks are there because they just want to live a healthier life, or find ways to keep active and do the things in life that they want to do. So kind of the toolbox of opportunities that they build throughout the 6 weeks are things that they can use as interventions on a daily basis. And yeah, so these are the types of content that are expressed in the 6 weeks. So techniques, things to deal with more of kind of the social emotional side of managing, whether it be frustration or fatigue, poor sleep, the role of exercise and improving you know, muscle strength and flexibility in order to manage chronic pain, appropriate use of medications, communication strategies, healthy eating, the importance of, you know, rest and not overdoing it, as well as, you know, how to make good decisions and evaluate possible treatment options. So I think I'm going to pause there with the slides. So I'm going to stop sharing my screen, and I think I'd just like to allow for any questions that folks have.
I
Thoughts
noticed
and
in the
response?
chat, I'll start with Heather had a question about the program, if it was modeled after another state. Heather, do you want to share that question?
Oh, she did. It looks like she did answer. So
Oh, okay.
it is based after the chronic disease self-management program. I asked because I'm trained in some of those areas. So, so is there my question would be, is there, so with the funding that you have, is this funding that will be disseminated out to organizations to help make those programs more robust, like exactly
Sure.
up here?
Sure. So you're spot on, Heather, and I'm so excited to hear that you have experience with the chronic disease programs, because all of these self-management education programs are kind of housed under what's called the National Self-Management Resource Center. They were originally designed at Stanford University. And if you've heard about the chronic disease self-management program in New Hampshire, often it's referred to as Better Choices, Better Health. We kind of consider that kind of like the trunk of the tree. And then if you picture, there's these kind of like offshoot branches that leaders can become trained in this chronic disease self-management program, and then take these kind of branch off programs to get into more specifics. So this one in particular is, how do I sign up? That we're focusing on is the chronic pain option. So that's kind of like a branch off of the tree. There's another one geared towards diabetes self-management. There's an arthritis self-management program. And really, you know, they're just, I have some experience in facilitating these in the community, and just one of the parts of my job that I just always loved the most, because they really do empower people to, you know, to take action and connect with each other, and you see them people realize that they're not alone, you know, in their struggles. So it's great. It's just a fantastic way, I feel like, for people to get information, again, from a non-healthcare setting, and gain some motivation to help implement it. And what's great is this program is conducted with fidelity, and there are pre and post measures, as well as 6-month surveys that are conducted with participants. So what we really hope to do is create a nice data picture in New Hampshire for the outcomes related to implementation of these workshops. Currently in New Hampshire, we only really have data about the chronic disease self-management workshops, and they're kind of 6-month outcomes, which, you know, they're certainly not long-term, but it's longer than the day you finish a class and do an evaluation or a survey. So we really hope to create a nice data picture for these. So Heather, to answer the second part of your question, yes. Currently, training is conducted through Southern New Hampshire AHEC. So they hold a license for this program in New Hampshire, and they do the leader training. And typically they offer 1 leader training a year with funding that they receive from the state. And so through our grant, we are going to be making those opportunities more readily available. The trainings will be free for leaders to participate in. It is a 4-day training to become trained as a chronic disease self-management leader, so kind of the trunk of the tree. And then an additional 2 days to be trained in the crossover program to chronic pain. So it is a 6-day training commitment on behalf of the facilitator. So lengthy, but I will say it's an awesome training. So I would highly encourage anybody interested to, reach out, and we'll gladly share the information of training opportunities that are coming up. Beyond that, we do have some dollars dedicated in our grant to support workshop implementation in communities. So you could almost kind of refer to it or think of it as like a stipend or a mini grant during the 2-year time period that would help to support the implementation. It may not completely cover the time based on your pay scale and your organization, but it's there as an incentive, I would say, and a kind of a thank you and an opportunity to help support leaders and organizations in implementation. So as leaders enter the training, we would express those opportunities that are there, and probably make, as trainings come about for leaders, let folks know that, once they complete the training, here are some opportunities to help seek some funding during the next couple of years to support that intervention or implementation.
Thank you. I think there was also a question from Kathy.
I was just wondering if there was any follow-up once someone completes a workshop, or any supportive services that they could engage in. So it's not just a one-time thing where they attend a workshop, maybe get that peer support and that information, and then they're left on their own.
Sure. So what's great is it is once a week for 6 weeks. So on behalf of the participant, it's not a one-time thing. And oftentimes these folks really do forge relationships with their peers. So I have seen, honestly, in many occasions that people continue to meet after the 6 weeks is up and form their own little support group and connection. So there's certainly that opportunity if people feel that connection and that empowerment to keep going. We encourage that as leaders for people to stay connected and support each other. And while it is a program with fidelity requirements, there's absolutely nothing wrong with saying to folks, here is a list of available resources in your community that you could seek out, on your own. We can't promote particular practices or a service or something that is, but if you have like a list of area resources that you would want to share with people as a way to keep them, engaged, or allow them some opportunities to explore other things locally, that is certainly allowable and encouraged. As I mentioned before, there is a 6-month follow-up. So as part of the program implementation, after the participant completes the 6-week workshop, there is a follow-up survey that's done at 6 months where some data is collected. And we've actually built in some incentives to help collect that data at 6 months for the participants. Because as you can imagine, sometimes reaching out to folks 6 months after they've taken part in a think about maybe if somebody called you 6 months after you went to a conference or a workshop and tried to pick your brain about it. So we definitely want to encourage folks to participate in those 6-month follow-ups for the data collection purposes. Is the follow-up done by the trainer or UNH? The follow-up is actually done by Southern New Hampshire Area Health Education Center. So the facilitators turn information back into the licensing organization, which is Southern New Hampshire AHEC. And they actually do the post-workshop outreach at 6 months. So what's a good strategy I've always found on behalf of the leader is to perhaps give their participants a heads up that, hey, it's been just about 6 months, you'll be receiving a call soon from someone at this organization, and it would be wonderful if you'd participate in the evaluation. But they actually do the questions and conduct the survey with the participants.
Thank you. Thank you so much for coming, Melissa and Kendra. I think your emails are posted in the chat for anyone who has any follow-up questions about this program. I'm going to encourage you to stay close to this group because this is a group that's very highly invested in preventing substance misuse, and we will help you. We've got those connections to the infrastructure that exists in Carroll County. And I'm sure I know there's individuals that at this table here and on our email list who would be interested in that Train the Trainer and to kind of help you to make those trainings happen in our region for sure. So
that's fantastic. I could also see your team potentially being a great resource as we begin to explore the need for resource development with the Partnership for Drug-Free NH. So if there's opportunities, if we're looking for groups to survey or get input on what resources are of need, then I'd love to know if you might be an interested group to provide some feedback or information as well to help.
I'm sure there would be willingness. And I also would just remind you and encourage you to reach out to all of the public health networks, because we are just one of 13 like groups across the whole state who do what we do for their own particular region. And there's a person who does my role in each of those 13 regions, and each of them has a work group like this of stakeholders for those regions. So that's, you don't have to start from scratch at all when it comes to this type of work in the state of New Hampshire, and I'm sure people will be very, very excited to step up and help you with this. So thank you so much for sharing
the
this.
opportunity. I see. I'm just going to note before we may sign off in a little bit.
Yeah, that's fine. You're no obligation to stay for the full thing, but we really appreciate your time to come and share this out. And then we'll try to capture some of this for the minutes, and we have your follow-up that we'll put in the minutes for anyone at this group to just reach out to us and let us know what is the next steps you want to do and how we can help you make that happen.
Great. We thank you so much.
Yes.
Thank you. Thank you. I have another guest here today. Ashley, how are you?
I am good. Thank you so much.
Ashley's here from SOS Recovery, right?
Yeah.
And they have a brand new, new grant project that they are launching related to criminal justice and recovery supports. So I think what I'd like to do in the interest of time is give Ashley some time to share information about her program, because I think it's really important for us to know about it, because they've extended out their services to our Carroll County region. And then after that, and we'll have some questions and answers for Ashley, and then I think we'll just go around the table and do our updates from our organization, and I bet you that will fill out our time for today. Our plan was to go to 10:30. Oh, does that sound good to everybody? Okay, so thank you. Welcome, Ashley, and you can introduce yourself.
Yeah, hi everybody. A couple familiar faces. My name is Ashley Lewis, and I am from SOS Recovery Community Organization. I'll be brief and quick. I won't take up too much of your time. But so we just got a grant that targets individuals in the criminal justice system in rural areas, and it's a telerecovery based program. So it's a lot. So the name of it is Peer Strength, and it coincides with what we're doing in this region down here. The difference is that how we will be present is virtually. So we have a presence in the Stratford County Drug Court physically and virtually due to COVID. But as we roll and move forward with this particular grant, we will only be present virtually. So we have a web-based platform. All recovery centers have shifted to a platform called Recovery Link. And through that platform, we have the ability to really break down and help people offer comprehensive recovery supports to individuals. And it helps break down and helps them goal set. So we can offer, we're basically resource brokers. It's very peer driven and we just help guide individuals. We had our first referral and that came from the case managers that work in the community from the prisons. That's been going really well. And we just launched ourselves in the Cheshire County Drug Court. So we have, as of last week, been present in the Cheshire County Drug Court. So that's kind of where we're at right now. And we have a few different ways that we can receive referrals. So we can receive them specifically through our website, and we have a DocuSign where if you click on the link specifically, it will send it right to my email, and then I can have the peer specialist reach out to that individual. We can offer our emails individually also. And as well as we can get everybody my peer specialist's phone numbers, who one of them just logged on. She had to take care of some stuff this morning, so she's now here, but Nicole
Welcome,
is
Nicole.
one of the peer specialists that works with these individuals. And so, yeah, we are targeting individuals in the rural areas. So we have a flyer that I'm not sure if Nicole has got that out to you. But we can get you the referral, the ways to be referred, as well as our flyer that you can have as well. So yeah, that's really a general summary of what we are doing right now. And it's about a 2-year grant. So we have a couple of years to work with it. That's quick, a little brief overview of what that looks like.
No, that's fine. And Nicole, do you want to introduce yourself too?
Hi guys, I'm Nicole. I work at SOS. I work in the Rochester office. I'm a criminal justice recovery support coordinator. I didn't get to hear exactly what Ashley said, but is there anything you guys have any questions for me?
I guess I do. I'm finding a lot of resistance getting into our local drug court. How did you break through?
Well, I think one of the most important things about our positions and roles is we as ourselves have experience in the criminal justice system. So I personally have relationships with drug court, being that I am a drug court graduate. And so I just kind of started with having my connection with the Stratford County Drug Court and got connected through them. And it just, one thing led to another.
Thank you.
Yeah.
So I know that Bob Nyland has been an occasional participant of our group here and keeps in touch with our minutes and such. So perhaps after this meeting, we can do some outreach and help maybe with that connection, Eric.
Yeah, that'd be great.
Yeah. That's great. So if Ashley and Nicole would put your name and email in the chat box, and we'll share that out for people, for anyone who wants some follow-up information on this. Unfortunately, I don't have anyone here today from criminal justice. Occasionally, we do have law enforcement that participates in this meeting, and sometimes we have restorative justice as well. But we'll make sure to capture this information in the minutes and send it out to our larger group. So that will be good.
Awesome. Thank you
Yes.
so much.
Thank you for being here. And I put a link to your website for the page that describes the Peer Strength program. And so you can see that in the chat box, but then we'll also include it in the minutes as well.
That's great. Thank you so much.
Awesome. Thank you for being here.